Thank you. Look, I think releasing the modelling now has become a political necessity after the government has gone back and forth on are we or are we not going to release it. Because one of the key issues here has been lack of transparency and a lack of trust because of slow messaging. Are there disadvantages to releasing the modelling? Yes, you're going to get some armchair commentary of people who think that modelling is a prediction. It is not. It shows you several possible future scenarios with which to base the decisions on. I think it'll be useful to see from this point onwards. It'll be interesting to see the modelling that the government had available to them back in January and February to see if the actions they've taken were commensurate with the data that was provided to them. I suspect we won't get that. That's okay. Let's move forward. I think releasing the modelling is going to be an act of trust building, something we sorely need because the communication has been lacking so far.
All right, let's put this to the politicians. We've got Katie Allen here, who's a former paediatrician, also a medical researcher, now a Liberal MP, and Chris Bowen, who is the Shadow Health Minister. Katie Allen, how long is it going to take for the federal government to release the full scope of modelling to the public so that all of us, including the medical profession, can actually see it?
Well, I think tomorrow the National Cabinet is going to look at the current modelling and discuss the release of it to the public, is my understanding. It is worth mentioning that this is a very rapidly moving scenario, and modelling was actually discussed as far back as 2 weeks ago and published on the front page of the Sydney Morning Herald, where there was modelling that there could be quite a staggering amount of deaths, even here in this country, somewhere between 50,000 and 150,000. So there's been a lot of conjecture about what could or could not happen here in Australia. And there are lots of modelling available from Imperial College, Johns Hopkins. There's live databases that people can follow. The Department of Health has all of the data that's on its website. And every day, Greg Hunt and the Prime Minister and Brendan Murphy come out and tell Australia where we are and where we are planning to go. So I do hear that people are concerned about modelling, about into the future. And I think that now that the situation has stabilised, now is the time for people to have a look and see, well, where to next from here? It's been a very rapidly changing scenario, and I think it's very appropriate that people know the data as it comes to hand and knows what the government is doing to actually deal with this rapidly moving pandemic.
To be fair though, Katie Allen, at some of those press conferences, the Prime Minister has said to the public, don't look at other modelling, don't look at other graphs that you see, trust the government and the information it puts out. And yet we've just heard examples from the medical profession where they're actually having to rely on overseas data, creating their own graphs, for example, to be able to model the scenarios. Why has it taken this long for the government to be willing to put this to the public?
Well, as I said, I think they have been putting it to the public, and the issue is that there's been quite a difficulty in knowing which curve we're going on. And we here in Australia are wanting to carve our own curve. And there is very good data that we are carving our own curve. We have one of the lowest mortality rates in the world. We've actually had this pandemic here on our shores for virtually the longest of any country in the world. I think we were the third or fourth country to have a case. We're right in the middle of Asia. We've had tens of thousands of Australian Chinese return from mainland China. And so it's not that we've been immune from being exposed to the pandemic. We've had it here for 11 weeks. I think we've had it earlier than Europe. And yet the measures that we've taken, which have been proportionate and layered on, particularly some of the early steps that we took very proactively to call this a pandemic 2 weeks ahead of the WHO, to put levels of border control on, particularly with regards to travel from Wuhan and from mainland China, followed swiftly by Korea and South Korea and Italy and Iran. Those measures were very swift and very responsive. So a lot of the measures that we've been taking have been working, as the Prime Minister has been very clear, in a rapidly changing environment. So it's like he's got a plane and control, and there's 25 million passengers, and he's taking us to a safe harbour so that we can weather this storm that is both a health and economic storm. And we are now at a steady state with a decrease in the amount of new cases that we're having, which is extremely positive and encouraging. And I think now is the time to sit down and say, well, where to next? And I think that's what you'll hear tomorrow from the National Cabinet.
Chris Bowen, I mean, do you agree that the government has been upfront about the modelling, as Katie Allen has described it just now?
I think it would have been much better if the modelling was released all the way through in real time by the government. There is modelling out there. It's not government modelling. We're reliant on the work of academics and experts. Of course, modelling is imperfect. Of course, modelling has its risks. But if we want the Australian people to trust governments, we need to trust the Australian people with the full information that's available to all governments. So I think it would have been much better, with respect, if the modelling was released in real time from the beginning of this crisis. The Australian people were taken into the confidence of the government with the various scenarios that were before us, maybe, you know, best case and worst case and what we expect. I think if the government did that, not tomorrow, but right from the beginning, there would have been a lot more trust in the decisions that have been taken.